In our digital dive, a KARE 11 investigation found that COVID-19 is becoming a leading cause of death here in Minnesota. It's a discovery that has hundreds of you sounding off right now on our KARE 11 Facebook page. So we're going to tell you who's most vulnerable and why experts say our numbers continue to climb. Now, the number of weekly coronavirus deaths in the state averages 153 over the last 2 weeks. That only trails cancer and heart disease, according to death records from the CDC and the state of Minnesota. Yesterday, Minnesota reported 30 COVID-19 related deaths, the highest single-day total since the outbreak began. Our investigative team also found that Minnesota now has more virus deaths per capita than any neighboring state, and our overall death rate compared to states across the country is on the rise. So why the high numbers? Well, State Infectious Disease Director Chris Irishman says the beginning of the outbreak, Minnesota concentrated their testing on more vulnerable populations in long-term care facilities, which has resulted in more deaths classified as COVID-19 related. Now, it's something the Department of Health says other states haven't been doing.
We put our energy into making sure that we were identifying cases quickly and early in our long-term care settings. Populations who, over time, may be more likely to count as a death case than other populations.
Now, according to the state health department, as of yesterday, nearly 84% of the state's 485 coronavirus-related deaths were people that were living in these long-term care facilities. Now, this investigation, there's a lot to it. There's a lot of numbers. So if you want to read up more about it, we do have this story posted right now at KARE11.com.
Yeah, but breaking down the numbers so we can understand this a lot more. Alicia, thank you.